Joining us today for Women and Alcohol Drinking to Cope. Research suggests that people who drink to cope, as opposed to drinking for pleasure, have a higher risk of developing alcohol use disorder. And while every individual's reason for drinking are different, studies have found that women are more likely to drink to cope than men. And during this virtual lunch and learn, we will provide an overview of data collected for our newest data brief, Women and Alcohol Drinking to Cope in a Pandemic World. This brief provides context for why problem drinking is increasing in prevalence among women. It also compares national data to Health and Human Service Region 6 states data, including Arkansas, Louisiana, New Mexico, Oklahoma, and Texas, and exposes and explores strategies for addressing this problem. This is a lunch and learn, so please start introducing yourselves if you have not already in the chat, including your name, your location, and the role you play at your organization or in your community with the uses of data, and what you're having for lunch. This is our acknowledgments. This presentation was prepared for the South-Southwest Prevention Technology Transfer Center Network. The opinions expressed herein are the view of the PTTC network and do not reflect the official position of the Department of Health and Human Services or SAMHSA, and no official support or endorsement from SAMHSA or DHHS has been provided about the opinions described in this document. This work is supported by a grant. Next slide. Our learning objectives for today are to examine the trends and contributing factors for women and alcohol, both nationally and within the South-Southwest, and also to identify one way the data trends can be applied to assist organizations with creating a prevention plan. This is our roadmap for today. We're going to provide some introductions, which have already started. We'll give you a little background, talk about some emerging trends and the health consequences. We'll also explore the epidemiology of alcohol death rates and provide some practical solutions for prevention professionals. We'll save time for some questions and answers. And then, of course, we'd like you to take part in our evaluation. This is our roadmap for the day. And now I'm going to introduce you to the people who will help you keep your eye on the road. Our presenter will be supported by 3 additional staff members. I'm Derek Newby, and I'm a trainer and technical assistant specialist for Region 6. Also, Dr. Beverly Triana-Tremain, who serves as the epidemiologist for the Southwest PTTC. She has over 30 years of experience in technical assistance and training, evaluation, research, and quality improvement processes. And also by Sheila Boswell, who is a highly experienced project coordinator that serves as the assistant evaluator for the South-Southwest PTTC. She writes, designs, and analyzes data for training and technical assistance reports. You may ask your questions in the chat during the presentation, and a member of our team will either respond directly to you or repeat your question for the team to answer as well. Now, I am honored to introduce you to Nicole Schoenborn, our evaluator. Nicole brings 20 years of award-winning public health experience to the South-Southwest PTTC. She currently oversees all evaluation, reporting, and analysis, and manages the evaluation database for the South-Southwest PTTC. She plays a vital role in providing high-impact training and technical assistance services to the prevention workforce, emerging prevention professionals, organizations, and community prevention stakeholders. Ms. Schoenborn holds multiple certifications. Namely, she's an internationally certified prevention specialist and an adverse childhood experience interface certified instructor. She received her master's degree in experimental psychology and bachelor's degree in psychology from the University of Central Oklahoma. Nicole, we are in your hands. Please take the wheel and let's ride.
All right. Thank you, Derek. That was so nice. I'm so happy to be with you all today, and I see a lot of familiar faces, and this is such an important topic. So I'm glad that you all are so interested. We have over 100 folks on today already. So I'm excited that this is an important issue to you all. And I want to also thank, before I get started, my partners here who have really helped with this research and with this data brief, Sheila Boswell and Dr. Bev Tremain. Their work has been very instrumental into what we're going to present today. So I want to publicly thank them for the work that they have done on this brief. Just kind of a background to this data brief and why we're here. So women's rates for drinking have been on the rise, and we'll get into some of that. But we had this thing called the pandemic, which a lot of you are familiar with, I'm sure, which created an interesting backdrop for a lot of different types of substance use. One in particular among women is alcohol. And sometimes alcohol gets overlooked these days, right? Because we've got opioids, we've got all these discretionary grants coming in to tackle certain things. And meanwhile, we've got this burgeoning kind of public health crisis coming for women and alcohol kind of going on in the background. So what happened in the weeks following the beginning of the pandemic is we started seeing some alcohol availability increase. And some of those biological and environmental factors that are unique to women help contribute to this public health crisis for women. And so that's sort of the backdrop and why we decided to tackle this issue. And we've looked at the data from multiple angles. We'll also highlight some really important things that are specific to our region. And we welcome all of you that are here from across the nation, but we will be focusing in on some data later that is specific to the South Southwest. So, all right, so I alluded to that we have some increases in alcohol sales during the pandemic. Following the first few weeks, we had a 262% increase in online alcohol sales. And this was research that was documented as things unfolded during the first few weeks of the pandemic, according to Nielsen. And then there was a study done by Pollard et al., which all these references are located for you in the slides at the end and also in the data brief, which we'll be posting in the chat there. So that you can look at those references, but all of this sort of laid the groundwork for the problem that we'll be talking about today. One thing I want to go back to, though, is I want to ask you all a chat question. How has alcohol availability changed your prevention landscape in your community? What are some things you're seeing in your community? And if you want to just post those in the chat there, that would be great. And Lori has posted that chat question. How has alcohol availability changed the prevention landscape in your community?
Okay. I know y'all are filling the chat up now. We're waiting for those answers to come through. Okay, we have one from Olivia Jenkins. I feel it has made an interesting dynamic with our too good for drugs kiddos. I often have kids bring up the Illinois law that says they can drink at their home if the parents let them, which definitely causes them to further think it's not a big deal. Wow.
Yeah, it's a
Susan
kind of
says,
normalizing it.
Susan says we are seeing an increase in binge drinking among teenage girls. Dana says the gambling facilities are popping up everywhere, normalizing it as well. Kim says delivery service began during the pandemic. It's still going on now. So concern about who is receiving a home delivery service. So there is concern. They're still continuing to come in. I'm gonna, you like me to continue, or would you like to continue now?
Yeah, we can go ahead and continue. Just keep posting those ideas in the chat, y'all. And I think it's really important to highlight what you're seeing in your communities and the struggles that this sort of, home delivery, especially, being able to get alcohol delivered right to the door. We don't know who's receiving that. There's all sorts of things that the pandemic sort of normalized. And so with this data that we will be presenting, that also presents some interesting issues because we see rises in alcohol-related deaths for women. But as we know, it takes a while to get to alcohol-related deaths. And so these increases and normalization of, sales and drinking could lead to even more issues down the road. So that's really important information that y'all are posting in the chat. And Dr. Tremain has also posted a resource from the National Institute of Health there on state policies on youth drinking. Thank you, Bev. All right, so let's move on. So our emerging trends for women, and this was out of the Pollard study that I referenced. They saw a 39% increase in alcohol-related problems for women during 2019 to 2020. From CDC Wonder, which is what we use to track alcohol-induced deaths, there was a 27% increase from 2019 to 2020 for women in alcohol-induced deaths nationally. And then Pollard et al. Also found a 41% increase in heavy drinking episodes for women from 2019 to 2020. So that just sort of lays the groundwork for what started happening during the pandemic and that first year after the pandemic ensued. So what are some contributing factors that the research has found? So this was some research done by Kaya La et al. And what they found, and they studied 38 countries through a survey, including the US, and found that the characteristics of alcohol consumption during the pandemic, including being female, being younger than 50, living with children, working from home, psychological distress, and higher educational attainment, which is really interesting. And so one of the factors that a lot of the research points to is this additional stress, this additional psychological distress that in particular women were experiencing that caused more frequent drinking during the pandemic. And so what's interesting about women is this particular issue around psychological distress and how that has really propelled some of those rates. And there were some special issues during the pandemic with women that we'll also get into that might explain some of this. But that's across 38 countries. So those are pretty interesting results to see those factors emerge from so many different countries during the pandemic. So we have a chat here for you all also. What do you think has contributed to women drinking in your community? What are some factors that you think, other than, increase in alcohol sales, which we already talked about, but what are some factors that you see in your communities? Darla says stress. Derek?
Kathleen says isolation, boredom, relationship issues, and has said financial stress. Casey Matthews, burnout and compassion fatigue. We are just flooding in now. Coping with mental health, stress, single parenting. That's something different. Co-addictions. Thank you, Danny.
And that's some of the research too, is that if there were issues prior to the pandemic, those kind of got magnified. So those co-occurring disorders. True.
Rosie has commented that t-shirts at Target, they have wine o'clock t-shirts normalizing drinking for mothers specifically.
Oh, wow. Well, and one thing we've also seen, I saw some, advertising around, skinny drinks for women, that don't have as
True.
many calories. You can drink this and, not gain weight, those kind of things. So um, similar to tobacco, right? And advertising, our alcohol sales companies started targeting women at home during the pandemic being under stress.
Interesting. Brenda has commented the need to be independent, apparently being associated with women and drinking as well, and
And we look,
socializing to fit in with friends.
yeah, compounded trauma too, Katie says. Mental health challenges, alcohol
Oh,
advertising, mom water.
water. Jordan has said unpredictable changing policies and suggestions. Stay at home, not stay at home. Apparently those mixed messages.
Yep, all those things I think definitely led to what we're seeing here in the research and some of the data that's emerging. So thank you all for including those. Some of those I wasn't aware of. The mom water is one I haven't heard of. So interesting. Politics and media too. Yeah. And Dr. Tremain says the industry making sparkling water now that looks like a beer to attract more youth. Yeah. Yep. Well, thank you all for the great participation there. It's great that you all are so involved, and on top of this, I can tell you've been thinking about it. So thank you. All right, so some of this, and I think this alludes to some of what you all were saying in the chat, is work-family conflict, drinking to cope, particularly among women. So some research shows that women, even prior to the pandemic, if they experience a negative work climate, especially when it comes to balancing home life, right, with children, working from home, flexible leave, some of those other policies that can really affect women that are taking care of children, especially, really became more of an issue as the pandemic ensued. And so this was even happening prior to the pandemic from the research, but once the pandemic happened, sort of magnified this issue. Right now, our childcare facilities are closed. If your child's sick, they can't go to school, and so lots of things going on, which leading back to women, if they experience psychological distress, that's leading to more drinking, particularly for women. All of these issues really come into play here. So that's just illustrating, what's going on here. Why are we seeing this? And we'll talk about later, maybe some ways to address those things. So another issue that we've seen happening even prior to the pandemic is this issue that we call gender convergence. So you're like, Nicole, what is that? Well, all that means is that drinking consumption, alcohol consumption, the graph is kind of looking like this, where women have been, drinking less in the past. Here's men, their rates are starting to converge and become more similar, and drinking at more similar rates. So some of the reasons for this people cite in the research is, for one thing, there's more women working, issues of equality, work stress, trying to, again, that work-family conflict, trying to balance that. But some special issues that we haven't always accounted for with women. We're really good in prevention at looking at fetal alcohol spectrum disorders and talking about those risks and risks with miscarriage related to pregnancy. However, what we haven't really talked about as much is that women metabolize alcohol more slowly than men. And because of this, there's some, special issues that come to play for women that make them more at risk for certain health consequences. So over here to the right, we have some of those. And I was not actually aware of the cognitive decline, but that is actually, something that heavy drinking can place women more at risk for breast cancer, some heart conditions, and liver conditions, including cirrhosis. So these are some issues that, you know, when we're talking about public health messaging, when we're talking about prevention messaging, we definitely need to focus on fetal alcohol spectrum disorders and the risk with drinking, you know, in women for that. But we also need to focus on these because these will start affecting our women as well. So now we're going to get into some of the data. This is the exciting part, I guess, for those of us who love data. So these are our epidemiology of alcohol death rates. And we're going to start with taking you on, you know, sort of the national level, going to the regional, and then we'll look at some state data. And all of this data was analyzed in Tableau, Public, and Dr. Bev Tremain has done an amazing job of creating these maps. And Sheila has really helped create some of these nice visualizations with the graphs here. So we'll start with, on to the left, we have our alcohol-induced deaths in the US, which increased 58% for males and 100% for females from 2010 to 2020. So that's our national data, right? So we're still seeing increases in men. It's just not jumping up as much. And then off to the right, you'll see the same data, but for just for the South Southwest. And you can see that our rate increase for females was even higher than the national rate. So these are for the states of Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. That is our Region 6. And men's rates increased 58%, while women's increased 133% in the last 10 years. And you can also see there's a bigger jump in our national data for women from 2019 to 2020. While we didn't see as big of a jump from 2019 to 2020, we had more of an increase starting in 2018. We did have a larger increase in female alcohol-related deaths over the last 10 years than we saw nationally. So we also took the data and put it into a national map. And these are alcohol death rates for women by county, 2010 to 2020, age-adjusted rates per 100,000. And so what we did here, just to make this easier to, you know, visually look at, is we categorized the high death rates with the color red here. And then we categorized the low death rates in blue. And then when you look at the gray, those are that data that is unreliable. There's not enough data, so those are suppressed. So that's what the gray is. But as you can see, the Northwest and Southwest parts of the US definitely have, you know, high death rates for women. So you can see a lot of red over there. And then you'll also see some clusters like up near Maine and in Florida, but a huge concentration in this Northwest and Southwest area here. And then we've got some pockets in some of our Southwest states. So as you can see in the red for the counties. So for those, the low death rates, those are 1.2 to 5.5 deaths per 100,000. And the high death rates are 5.6 to 124.8 per 100,000. And in specific states that we saw really high death rates, we saw Arizona, Rhode Island, California, Washington, Oregon, New Hampshire, New Mexico, which is in our region, Nevada, Florida, Maine, Vermont, Colorado, and Wisconsin with the highest number of counties with high death rates. So this is what it's looking like at a national level. And again, these are just for women from 2010 to 2020. All right, so we then said, well, what's happening in our region? And I know some of you aren't from the Southwest, but I hope this is still valuable information for you. And maybe you can take this and do something similar in your region. So we looked at county and parish high death rates for alcohol in females, 2010 to 2020 per 100,000. And then you'll see under each state, we show the percentage increase for female alcohol-related deaths for the same year span, so 2010 to 2020. And then we've also highlighted the high death rate counties, which are also in red, and we've listed them off to the left of each state's map. So Arkansas had 145% increase for female alcohol-related deaths, and then you can see the high death rate counties here. And Louisiana had 104% increase for female alcohol-related deaths with their high death rate parishes right here. And then moving on to New Mexico, we had a huge increase in New Mexico, 222% increase for female alcohol-related deaths. And then you can see the high death rate counties here for women. And those are listed here. Oklahoma did not see as much of an increase, but still had several high death rate counties. So overall, the increase was 53%, but we still had several high death rate counties that are highlighted here. And then our last state, but not least, Texas. Texas had 115% increase for female alcohol-related deaths. And then those are the high death rate counties here listed. So overall, we did not see, we aren't seeing in general the lots of red like we're seeing in the Northwest and some parts of the Southwest, but we are seeing some alarming rates in some of our states, specifically in New Mexico. And Bev is noting here, note the gray is suppressed, and she's giving that that exact number there. Thank you, Bev. Appreciate that.
Nicole, you also had a question, well, maybe not a
Sure.
question, more so a statement from Heather Brizendine, who's wondering if Texas isn't reporting accurately.
Are you expecting Texas to be higher, Heather? Or lower than what you're seeing here? Just curious. Higher. Oh, okay, higher. Yeah, and remember, this is just up through 2020, right? If our women have started heavy drinking more, this is not consumption data, this is alcohol-related deaths. So you may be seeing higher consumption happening with your women in your states. And unfortunately, later on with, data and just as problems develop more from those high rates of consumption, we're likely to see higher death rates. So yeah, I see some other folks saying I was expecting Texas to be much higher. So it may be that you're seeing high consumption right now. And again, that might lead to higher alcohol death rates later for women. So I did want to point that out because sometimes that's confusing. These are alcohol-related deaths, not consumption. All right. Any other questions there, Derek? And Bev is pointing out these are based on death certificates and reporting. Yes. Thank you, Bev.
Good job, Bev. Nope, just several other comments about expecting Texas to be much higher.
Okay. Well, it sounds like we need to keep an eye on Texas. Oh. And Legine says, does this include all deaths, including accidents? That would be a Bev question. Vehicle accidents. Bev, if you want to help out Legine.
He's already answered. This includes alcohol as the underlying reason.
Okay, great.
Yeah, so alcohol is the underlying reason. However that plays out in the determination of the coroner, that would be the reason.
Okay. So it's basically what's documented on the death certificate. Yeah. All right, thanks, Bev. Okay. I know that's some pretty heavy stuff there, so stick with us, but I do think it's important as we think about what we can do in our communities. So, and again, Dr. Tremain, thanks for putting these maps together. These are wonderful for people to look at. And Sheila, thank you for the visualization you provided here. All right, so what are the implications for us as prevention specialists? We have an increase in female alcohol consumption during the pandemic, which is something I just kind of mentioned. And so while we just looked at alcohol-related deaths for women and saw that rise, that was pretty alarming, we haven't totally seen the outcome yet, right? Because there's always data lags, there's, other things that develop. The pandemic still continues to be an issue and be stressful. And so what will this look like in the future as we see more women consuming alcohol, doing heavy drinking? What will our alcohol related deaths look like in the future? And so that continues to be a concern as we see consumption rates rise. Also, we just noted that we saw the 133% increase of female alcohol deaths in our region alone from 2010 to 2020. And so all of this kind of points to, we've got this burgeoning public health crisis for women around alcohol coming. And something we haven't gotten into as much yet is that young women are heavy drinking at an earlier age. And so how is that also going to affect things? Some other things that are in our data brief that are highlighted that we didn't have a lot of time to get into on our lunch and learn, but I encourage you to look at, is that these rates are also increasing and following along with women of childbearing age. So as women are in that age group of childbearing age, we're seeing higher rates of alcohol consumption, higher alcohol related deaths. And then as they get to be, kind of mid-50s, the rates taper off. And so there's a nice graph in your data brief that Lori has posted in the chat, and we'll be sending out later as well, that really looks at that and provides a nice visual for how that looks as those rates increase during women of childbearing age. We've also noticed that these rates increase or at a more alarming rate for women that have children under the age of 18 in the home, and are even greater for women who have had children 5 years and younger in the home during the pandemic. So, there's lots of worries too around vaccine availability, right? Wasn't available for our younger kiddos. And so all of those things really have contributed to this crisis that is happening. All right, so as prevention specialists, when we're faced with a problem, right, one thing we can anchor ourselves in is that we know the SPIF, we know the strategic prevention framework, and it's a thing that we can use to solve public health problems in a data-driven way. And so we want to use the SPIF and think about, at each of these steps, what can we do to address this issue? And so during assessment, we can gather data and look at those epi trends in our areas and those factors that put women in risk in our communities. When we're looking at capacity, we can build community resources and readiness to support alcohol prevention strategies for women that address those unique needs, like work-family conflict, workplace policies, flexibility, leave support. When we're doing our planning phase, we can create a data-driven strategic plan with effective strategies for addressing women. And then in implementation, we can make sure that we're delivering evidence-based practices for women and alcohol, and making sure we do appropriate adaptation and fidelity. And in evaluation, my favorite step, we can monitor success toward our outcomes and really add to that research base of evidence for women and alcohol. That's another issue that is really critical, is that we don't have a lot of research, particularly for substance abuse treatment and other factors that specifically addresses the needs of women. And so a lot of the research has been done on men. So we really need to advocate for that as prevention specialists. And then we get to our overarching principles of sustainability and cultural competence. So with sustainability, we want to try to embed some of these interventions for women, some of these practices into things that are already being done. So, you know, talking to primary care physicians, talking to OBGYN, since we have the women of childbearing age issue, what can be done to work with those folks as prevention specialists to address some of these issues? You know, screening, making sure alcohol screening is done on a regular basis, those kind of things. And then we get to cultural competence, our other guiding principle. And we really have to pay attention to intersectionality. We need to involve a diverse population of women in our efforts, and really make sure that we are incorporating that into everything that we do at each of these steps and each of these principles. So that leads me to Lori's chat question, which what is one step you all can take to include women more during the SPIF planning process? What's something that you would like to address at one of those steps of the SPIF? Or something maybe you're already doing? So we'll give you a few minutes there.
Doom, 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 doom.
Everyone is just in shock, I think, Derek.
Sure, they're just putting together their best response to this question.
Right, right.
Okay, it has begun. Christine says, share this presentation with our local DWI prevention group. Excellent
Great.
idea.
Yeah, sometimes that's the first step, is just to get the information out there.
Johnny says it would be great to create a task force to talk about everything. Task force work well.
Mm-hmm.
Elise has replied, would love to do a focus group with women and girls in our community here in Sitka, Alaska, and learn more about how alcohol trends in this area.
Great.
Adrian says focus groups.
Yeah.
Bev recommends to include more women who have alcohol addiction so they can contribute their knowledge and skills, that life experience.
Mm-hmm.
Kim says to reach out to women in business groups with local chambers as well.
That's a good idea. Yeah, especially with the workplace policy issues.
Georgina says to consider awareness promotion to social media, marketing targeted to women. And Katie says to loop in existing parent advisory groups working in the field. Oh, yes, that's powerful.
Yeah, that's a good one too, especially with young women starting to heavy drink at a much younger age. Right.
Alexa says to account for stressors that don't apply for men, both societal expectations and personal.
Right. Amber says integrate services with domestic violence and substance abuse. You know, that's one thing we didn't touch on, but another factor related to increasing rates for women drinking is sexual assault and violence. And it can also place them more at risk for sexual assault and violence. Very good point.
Robbie has an interesting comment. It sure doesn't help when the state supports more laws that encourage drinking. One of the legislative laws we are watching and advocating against is strong liquor to be sold in our grocery and convenience stores in Oklahoma. The chamber and other groups need to rally around issues facing women.
Mm-hmm.
She says we are promoting women's recovery books At the library. Okay,
Oh.
alongside prevention content during Prevention Week in May. It's a great idea.
Mm-hmm.
Brenda suggests involving those who have a wider range of people, like celebrities, put their boots on the ground.
Yeah.
Bev suggests design programs and test them that are specifically related to how women change behavior, but also consider genetics and environmental influences. Thank you,
Right.
Bev.
It looks like we have one more comment from Tina.
All my team members are peer specialists with live experience with their own substance use of family, substance use, and this helps to connect with our client base.
Yeah, that's a really important group to involve and make sure that we're designing our interventions, you know, in the right way with the people involved that it affects the most, right?
That's right. Nothing for us without us.
That's right. That's right. All right. Well, thank you all. Those are all really great ideas. And it really kind of just brings us back to when we're faced with this kind of issue, we can go back to the SPIF and thoughtfully plan things out to address this issue. So thanks. So what about interventions and research? We kind of talked a little bit about that when we talked about the SPIF, but alcohol prevention interventions, you know, kind of meshing those and embedding them in women's health service, workplace alcohol prevention programs. Some of you mentioned some of those things, and involving businesses that support women, those kind of things, to help with this issue. Normalize seeking help. So one thing that's also in the literature is that there's a lot of stigma around women seeking help for treatment. You know, with things that it's hard for people to see a mother sometimes as someone who needs assistance. And so normalize seeking those things, providing childcare on site in a treatment facility. You know, those are all things that can help remove some of those barriers that women may be facing. And then lastly, advocate for treatment research for women. You know, all those physical issues we talked about and the difference in physiology of women warrants us doing research with women to find treatments that work more effectively for them. So thank you all. And so we have another chat here. What strategies do you have in your communities for women? I know we've touched on some of those, but do you have some specific strategies that you all are using to help bring women into prevention services or advocate for women or provide messaging?
Amazing things are you doing in your community?
That's right.
You share your ideas and what's working, then you can help others in other communities get things rolling as well.
Yeah.
We're all one community here.
Yeah. I know that one thing we were trying to do when I was at the health department is incorporate screening into primary care. And I have seen pediatricians do a really good job of that also. But I've also noticed in women's healthcare centers, I don't see as much of that. So it seems like our pediatricians are coming on board with addressing alcohol, you know, substance use issues, suicide, but I'm not seeing that as much in our women's health centers, at least from my perspective. So what are you all seeing?
Here in Arkansas, we're seeing more men get involved in women's issues. One thing I was involved in was with breast cancer awareness. I want to see that more also start happening with alcohol awareness and education as well. Oh, the chat is lighting up.
Yeah, it's lighting
Darla
up.
said, educating about FASD.
Right.
And Elizabeth says, free community ramp training. You got to tell us what a ramp stands for, Elizabeth.
Yeah, I'm curious. RAMP. I'll have to look that up. Kim says provide info to local gynecologists in the community. Yeah.
Tina says we partner with treatment facilities for women. The PFH facility is one of the only residential treatment facilities in our state that allows children to come into treatment with mom, and it's a woman's only residential treatment facility. We provide lots of education and resources for our clients.
That is awesome.
And our definition has arrived. Thank you, Elizabeth. RAMP stands for Responsible Alcohol Management Program for Severe Servers and Sellers.
Servers and sellers. Great. I hadn't heard of that. That's awesome. Yeah, and Tina, I remember when I was at the health department, we visited a treatment facility that was just for women and had they were able to have their children there with them, and it was just amazing. So it's nice to see those unique that unique implementation of service, you know, designed around the needs of women. More sober living homes with women and children. Great. Yeah. All right. Well, you all are on the right track, and appreciate those thoughts. And it's always interesting to see what's happening at the local level. You know, we can look at this data on a regional level, but it's really great to see what you all are doing on the ground and how you're addressing some of these things. Right.
So as we wrap up today, it's important to note that these are emerging trends. A 133% increase, though, is quite alarming. So the time to share this information with your coalitions and other prevention professionals is right now. That's why we're sharing this brief with you. And information is power, and research clearly shows that alcohol use and misuse among women is increasing. So at the beginning, we asked you what trends you're seeing in your community. Now I want you to start thinking about what can you do to reverse it? What has worked in your community before to decrease alcohol use in women? You see, the health consequences can be detrimental. Doing nothing can be as detrimental as those health consequences. Studies show that women start to have alcohol-related problems sooner and at a lower drinking amount than men, and for multiple reasons. So again, we ask you to share this information with women and those who care about women, because women are less likely than men to receive treatment for alcohol use disorder. And yes, as someone has eloquently said in the text, prevention is the key. See, the practical solutions for prevention professionals that have been shared here with you today can help inform your prevention efforts. We have an upcoming service that I'd also like to remind you about and remind you to register for. And I'm gonna have, we can have that posted into the chat now, Lori. It's called From Cleaning to Mapping, which it's gonna take place on April 13th. And Dr. Beverly Triana-Tremain will provide a highly interactive webinar that will focus on how to export, clean, format, and map CDC Wonder data into Tableau. Participants can observe the map making or follow along on their own, or download a free version of Tableau Public. Some preliminary steps are necessary to follow along, but don't worry. Before the webinar, registrants will receive instructions outlining those steps. Don't be afraid to learn something new. So I encourage you now to register today and become a data-driven decision maker. Next slide. Now is our time, as I promised when we set out on this road, for us to hear from you. What are your questions? What have you learned today, and what do you still have a few questions about that any of our staff members can help you with? Johnny has said I run a Boys and Girls Club, so my emphasis is on prevention with all of my club members. I could get information. Where could I get information for these young individuals? Bev, would you like to answer that question?
Yeah, you might check out the YRBS from the Centers for Disease Control. If you can go to the yrbs.cdc.gov or just type in YRBS CDC, you can go there and download what is happening in your state related to youth. I believe 6th and 8th graders, and then high school students as well.
Excellent answer. And I'm sure there's local data available as well.
Oh, I'm sorry, Derek. Actually, you bring up a really good question, and you know, the youth really, if we're focusing on youth, we're focusing more on upstream intervention and data. So I think that's an excellent way to look at it. You can always, that's a good approach, just to focus upstream, you know, before we get to alcohol addiction and of course death.
That's correct. Debbie asks, I'd look to know data on, I'd like to know data on the uptick and downtrend on women drinking in this region post-pandemic as things normalize. Has there been a downturn?
I think with the data lag, we don't have all that data for CDC Wonder yet, but Bev would have the detail on that.
Yeah, we just now received 2021 data. And so you can run it from 2018 to 2021. So we'll be doing that.
But knowing this, also, there's that reason, you know, we have the SPIF right in front of us to start doing those assessments within your community and go out and start talking with the youth and doing your own assessments to find out what are the trends that are occurring within the youth. You can also look to local emergency rooms and request data from them on accident reports. You can talk with your local police department and find out if there's been an uptick in drinking and driving arrests. There's a lot that you can do locally to try and find out what's going on in your specific community so you can start addressing those concerns. This is the contact information for Nicole Schoenborn, your primary speaker for today. But I want to also inform you that if you or a loved one is struggling with alcohol misuse or addiction, it's important to know that there is help available. We all play a vital role in normalizing the seeking of help in our communities. We can be an example, we can talk with other people, and we can be the example of talking about this issue in public. So if you have further questions related to this brief, of course, please contact Nicole Schoenborn at our PTTC. Her email is nicoled@ou.edu. You can also contact us via website. And we encourage you to join our mailing list as well. If you come to our website and join our mailing list, so we can provide information to you regularly on the different services that we have coming up. And we want you to subscribe to us as well in our newsletter so you can get that as well. Please. So this slide and the next one are references that were discussed during the service. And they will be included when this slide deck is posted to our website. So we encourage you to download that slide deck once it's uploaded to the website. You will be notified. Next slide. Just want to remind you also, this is being recorded and it's going to be posted for you to view as well. And you'll get notification of that when that recording is available. So these are additional resources that we encourage you to access, including the publications from the National Institute of Alcoholism and from SAMHSA. And last, I want to remind everyone again about 988 suicide and the crisis lifeline as well, provided by SAMHSA. SAMHSA provides the resources and information to help states, territories, tribes, mental health and substance use disorder professionals, and others looking for information. and access to mental health crisis services. So if you are in crisis, dial 988 and also share this information with others. They do have a website as well, www.samhsa.gov /find-help/988. Or it's simple just to put in your search engine for SAMHSA 988. So in closing, if you or a loved one is struggling with alcohol misuse or addiction, it's important to know that there is help available. Prevention is our best option, but evidence-based addictions treatment can help you achieve recovery. Additionally, you may consider reaching out to an addiction helpline, such as the American Addiction Center, which operates 24 hours a day, 7 days a week. They provide services such as admission navigation and also answer questions about women's addiction and treatment programs. And they help you locate suitable rehab centers. So there is help available, and we encourage you to seek it. And we encourage you to encourage help-seeking behavior. With that said, I want to thank each and every one of you for joining us for this Lunch and Learn. I'm full of information, but I do got to get something in my stomach. So